Welcome to the Aced It podcast, where we turn science into sense. This is our 12th season of Aced It, and we're brought to you via the Justice Community Overdose Innovation Network, or JCOIN. I would like to celebrate a bit this season, for as we start season 12, we've reached 21,000 downloads and counting. Woohoo! Yeah, not because we're famous, certainly not, but because that means at least 21,000 times our listeners have learned something about overdose, opioids, opioid use disorder, medication-assisted treatment, and/or harm reduction. And that, my friends, warms my very grateful heart. Also, just a quick plug for a few other JCOIN features that you might not know about. Did you know you can get technical assistance for your organization from the experts at JCOIN for free? And did you know you can apply for small research grants to help fund innovative study ideas? Yep, through JCOIN. And did you know you can apply to be a JCOIN LEAP scholar or investigator to improve your own skills? Also through JCOIN. If you didn't know about these things, check out our website, jcoinctc.org, and learn about the many JCOIN offerings beyond Aced It that may help you learn and grow in ways that improve lives. With that, I'm honored that you're with us. I'm Danielle Rudes, your host, and this is Aced It. Thanks for listening to the Aced It podcast. This is episode 10 of season 12, our last episode this season, where we have been talking all about roles, responsibilities, and reactions to overdose. In these episodes, we have examined how people in different environments and roles prevent and react to overdoses. In today's episode, we'll focus on harm reduction and social service workers. These professionals play a crucial role in supporting individuals who use substances, offering everything from life-saving interventions to long-term support. We'll discuss some of the challenges they face, strategies they use, how their work is evolving in response to overdoses in the community. It's a lot. Get ready. Working in harm reduction can come with lasting emotional impacts. In a recent study done by Kalla and colleagues, 2024, entitled Everybody is Impacted, Everybody's Hurting, Grief, Loss, and the Emotional Impacts of Overdose on Harm Reduction Workers, the authors dove into what it's like for people working in harm reduction to constantly witness and respond to overdoses. They spoke with 11 workers in Toronto, Canada, specifically those in supervised consumption services who provided a safe, clean, and supervised space for drug use. And they found that many were dealing with serious emotional, physical, and social effects from the loss and trauma they encountered on the job. But the grief and burnout weren't just from the overdose events alone. They were made worse by the lack of support in the workplace, poor funding, and little recognition from policymakers. Emotional toll wasn't just limited to those workers in supervised consumption settings. In Massachusetts, another study by Schonberger and colleagues 2023 looked specifically at post-overdose outreach teams, which included those from various professions such as police officers, recovery coaches, social services, harm reduction, etc. The members of these post-overdose outreach teams engaged directly with overdose survivors and their families shortly after an overdose event. The study reported that out of these, most of these staff members often face secondary traumatic stress and compassion fatigue, especially when the trauma they're exposed to overlaps with their own personal lives or communities. One participant, a harm reductionist, noted, quote, "We went to the hospital and watched them work on him for like an hour and a half, and they didn't make it. And I remember, the ride back to the police station, we really didn't say anything to each other," unquote. While some staff members were able to find ways to manage their stress, such as setting emotional boundaries, prioritizing self-care, or relying on workplace support, however, others were not able to do so. In fact, support structures weren't consistent across teams. Another study conducted by Unichukwu and their research team 2023 in Philadelphia looked specifically at harm reduction workers, substance use treatment providers, and community organizers during the early months of the COVID-19 pandemic. Researchers used a model by Schoenfeld and Noseworthy to assess burnout in these workers, but found that it didn't fully capture what these people were experiencing. Yes, job demands, lack of resources, and work-life stress were all present, but so were things like safety concerns, unpredictable working conditions, and emotional strain of constant task shifting. The problem with burnout is that it's not just emotional. It can also be caused by structural barriers. Another study by Olding and colleagues, 2021, this time from Vancouver, looked specifically at overdose prevention sites staffed largely by people with lived or living experience of drug use, also known as PWLE, people with lived experience. These PWLE workers are incredibly valuable as they bring firsthand knowledge and trust into spaces that they work in. But the researchers found that many of them were facing serious burnout too, and a big part of that came down to the conditions they were working in. The study's findings highlight that much of the work done by PWLEs in these overdose prevention sites were often precarious. They were low paid, they lacked job security, and they lacked benefits. And many of them felt like what they do is what we often refer to as invisible labor, such as caring for community members, dealing with loss, and staying deeply connected to the overdose crisis even outside of work hours. Without full-time positions or clear pathways for advancement, many of these workers aren't taking the time they need to rest and recover. It's a cycle that's not just exhausting, it's unsustainable. On that note, a 2021 study by the Austin, Boyd, and the People with Lived Experience Drug Use National Working Group conducted surveys with 50 people with lived experience working in harm reduction services in Canada. Many spoke of the value and the pride they found in their work, specifically preventing overdose deaths, building skills, and fighting stigma. But they also pointed out deeply rooted inequalities. Many reported experiencing tokenism, power imbalances, workplace discrimination, and major gaps in pay and benefits. A related study by Pauly and colleagues, 2021, gave people with lived experience with drug use the chance to describe their roles and the aspect of the job where they described how their roles gave them a sense of purpose, helped them feel like role models, and created a sense of belonging. These motivators are powerful and often are what keeps people going despite their hardships. Even in the face of these challenges, there are examples of what's possible when there's structure and support for not just these services, but also for these workers. Wallace and their research team looked directly at the implementation of overdose prevention site after British Columbia declared a public health emergency due to rising overdoses in 2016. Within weeks, over 20 overdose prevention sites were launched, serving 550,000 people in the first year with zero, let me just say that again, zero recorded deaths at any site. The authors concluded that the success of these overdose prevention sites were by the government-sanctioned process to rapidly implement these measures, but also community developed. And while many people with lived or living experience of drug use also being involved in both the design and implementation of the services, that, my friends, is a strong recipe for helping people. A similar collaboration has been seen in the U.S., highlighted by White and colleagues in 2021. Tempe First Responders, Opioid Reproject in Arizona, has shown an incredibly collaborative effort. This initiative brought together police officers, peer counselors, social workers, and public health professionals. Not only was law enforcement trained to respond to an overdose, specifically how to properly administer naloxone, which reportedly saved over 80 lives, but they also built a full-on 24/7 crisis outreach response team that shows up immediately to an overdose and sticks with the person for up to 45 days, offering support and follow-up care. The early results are promising, but more than that, this shows what's possible when systems come together to care for others. Harm reduction workers, social service providers, and peers are carrying a massive emotional, physical, and structural burden. We've seen how meaningful this work can be, but also how draining and unsupported it often is. We can only achieve sustainable, compassionate responses to overdose when we invest in the people doing the work, not just with proper funding and benefits, but with equity, recognition, and care. Thank you for listening to the Aced It podcast. We love hearing from you. So if you have comments, topics to suggest, or some science you'd like us to cover in a future season, please write to me, Danielle Rudes, at Sam Houston State University. My email is drudes, D-R-U-D-E-S, at shsu.edu. And of course, thank you to the Justice Community Overdose Innovation Network, or JCOIN's, Coordination and Translation Center, funded by the National Institute on Drug Abuse, housed at George Mason University, where this podcast originated. Thank you to our fabulous scriptwriters and also my fantastic doctoral students, Bryce Kushmerek-McCune and Jalen Magana. And a huge and heartfelt thank you to the team at Slonky LLC for their wonderful production as always. Remember to check out our website, jcoinctc.org, for more cool JCoin features and opportunities. And tune in again soon for another episode of Aced It.